Calf muscle injuries, whether it's a complete tear of a large group of muscle fibers in your calf or a strain of part of the calf muscle, they're very painful injuries. They can take a long time to heal and sometimes even longer to return to sports and exercise. Would peptides or other regenerative treatments speed healing and recovery? My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, I've done a very similar video to this, calf muscle injuries, when I talked about hamstring strains, hamstring tears, basically injuries of the hamstring muscle. What you're going to hear today and in this video is very, very similar to what I talked about there. As I always say in these modern medicine videos, and when I talk about regenerative treatments, whether it's peptides or PRP or exosomes or stem cells, all of this is considered experimental by the FDA. They're not covered by insurance. I'm not promoting them or telling you you should do them. I just want to put more information out there and a little bit about the injury and the science behind these treatments so that you can talk to your doctor, you can talk to your orthopedic surgeon and see if it's potentially right for you and potentially get those treatments from your doctor. Now, calf muscle injuries, I've had them twice in my career. Both occurred while doing sprint training, once in college and then once, 4 or 5 years ago or so. And both times it took me about a month before I completely healed it. I mean, it was really painful. Even early on, walking was painful. So believe me, I know that it's tricky. And then in the conventional orthopedic surgery world, there's not a lot of ways to speed that up. You're talking about rest, obviously, from running and whatever activities and sports for sure that give you any trouble. For instance, you just can't do much of anything. So you're limited to like stationary bike and that kind of thing. And then maybe physical therapy as it starts to heal a little bit, but there's not really great ways to speed it up. Typically, they don't need surgery. Cortisone would actually slow the healing, certainly not something you'd want to use steroids for. So you're trying to think of, all right, what's going to speed this along? And so that's where people reach out. And I've had people in the comments to other videos ask about peptides and regenerative treatments for calf injuries. So that's why we're here. Okay. One thing, like I talked about in the hamstring video, that potentially would be helpful would be a PRP injection given to you by your orthopedic surgeon. It's been studied a lot for hamstring injuries, especially in pro athletes with some good results. Even though I'm not aware of studies specifically for calf injuries, gastroc soleus injuries, the same theory applies and it could potentially be helpful. Exosomes and stem cells, to my knowledge, have not been studied for that. They're typically used for osteoarthritis, but in terms of getting muscle to heal, the science at least makes you think that it would be helpful in terms of getting muscle regrowth and get it to heal. It just hasn't really been studied for that. Some people are much more cutting edge and want to try things that haven't really been proven because in theory it makes sense. Again, there just aren't studies to necessarily say exosomes or stem cells would work any better than PRP. But yes, you could do those. Again, considered experimental, not covered by insurance, typically fairly expensive. Now, a lot of people with muscle injuries say, hey, I want to just do something on my own to get better. And that's where they talk about peptides. As I've said in other videos, I'm a big believer you should get these from your doctor who prescribes them from a legitimate compounding pharmacy and not just buy peptides from these companies that are online. But I've got more about that in other videos. And I know I get a lot of angry people that comment about that, but most peptide experts feel very strongly about that. Having said that, could a peptide like BPC 157 or thymosin beta 4 help healing? It definitely seems like it could, especially the BPC 157 has been studied in animal studies for muscle, tendon, and ligament healing, especially the Achilles tendon, and does seem to promote healing. There's not as much data behind thymosin beta 4, which you might know as TB4 or TB500, but there's a lot of anecdotal data or evidence out there, people saying that it did help speed their recovery. So I think either of those potentially could be useful. I would argue as injectable forms, probably closer to the calf muscle rather than maybe in your abdomen, and certainly compared to the oral form. But that is something that you can talk to your doctor about. The peptides for more muscle growth, like a CJC 1295 with ipamorelin, may not have a role in getting the muscle to heal, but might help you get your muscle strength back after as you're recovering from that may make the rehab and the return to sports a little bit quicker. One of the things I will tell you sort of anecdotally from my two injuries is that it took a long time to get the calf size back and especially the calf strength back. So that's where there could potentially be a role. Again, please talk to your doctor and get more information that might be specific to you. I'd love to hear your experience with your calf muscle injury. Leave those in the comments below. Just understand if you leave a question in the comments, I can't give you medical advice in a response. So what I try to do is answer those questions in future videos like this. Make sure to subscribe to the channel, click the bell to be notified when I release a new video and when I start my next live stream like my Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.